Okay, welcome back from the coffee break. We are now going to speed up at least the interval, I guess, of presentations, because we found it useful in order to get us more into the mindset of for our exercise this afternoon, what types of practical things can be done, to have a block. Initially, it was called rapid presentations. They won't be quite so rapid. I mean, each presenter will have, I think, about 7 minutes to present something, and then the remainder of that quarter hour we've allotted to each can be used for some questions and discussions. So we will hear now from different NGOs, from different networks that exist. Who are they? What are they doing? How are they currently linking these issues, or in terms of the networks, what can they perhaps offer looking forward for us to link our efforts? So I won't take any of their speaking time and go directly to our first presenter, a colleague of the German WASH network, also one of the founding organizations of our network. He comes from the Johanniter, Dr. Oliver Hoffmann, the public health advisor for Johanniter, a medical doctor by profession, a sphere trainer. We've had the pleasure of witnessing his skills in training people in sphere, working in advising primary healthcare projects and humanitarian aid projects for more than 4 years as sort of what he's done, experience in developing and implementing, evaluating international projects for more than 15 years now. We look forward to your presentation, I think, entitled Sphere Standards, WASH in Nutrition and Humanitarian Aid. Oliver, the floor is yours.
Yeah, good morning, everybody. It's a pleasure for me to be here and talk about the Sphere principles and standards, which are very dear to my heart because they're providing a rights-based approach for NGOs working in the humanitarian sector. So the aim is to improve quality and accountability of humanitarian responses with a people-centered, rights-based approach and a definition of minimum standards. And I'm going to explain very shortly what the Sphere principles and standards are all about and how they are linked. I will give an example how they are used in WASH and health, and I will end with another example, not from the Sphere standards, but a project approach, which I think nutrition and WASH can be linked in very well. So the Sphere, the basic idea of the Sphere project, which is a handbook actually developed by NGOs, money donors, many different players, actually almost all players working in the humanitarian area, has principles. And the main principle was mentioned also in Hannah's session is the right to life with dignity. And we want to reach that right to life with dignity in humanitarian aid. And the idea of Sphere is that this principle can be reached only if we put in place the standards, which are also defined in the Sphere handbook. Then we have core standards, which are relevant for all projects. And we have technical standards, and in Sphere you have the life-saving technical chapters next to each other. That's WASH, that's food, that's shelter NFI, that's non-food items, and that's health. And I'm going to give you one example on how to use the Sphere handbook in practical terms. This is a situation from the Philippines where the water, an inundation took place, which was not in the press. It was a smaller incident. Children were affected very much as the whole population, and immediately or very soon we had an outbreak of diarrhea, acute diarrhea. And I'm going to show you how Sphere is dealing with diarrhea, how you can use Sphere in dealing with diarrhea, because there are several aspects involved. There's the WASH aspect involved, and I've put down pages also. Of course, if you are dealing with diarrhea in a crisis, you want to provide appropriate and adequate toilet facilities to ensure sufficient water supply, clean water supply. Also, quality checks are mentioned with E. coli, and distribution of personal hygiene items. So these are areas which you can find in the Sphere handbook coming from the WASH sector to deal with this problem. Then if you look at the health sector, other practical approaches to deal with diarrhea is to establish the responsible pathogens, ensure laboratory services to confirm the diagnosis, case management protocols, of course the treatment of diarrhea, also some epidemiological ideas are there to manage case fatality rates, to report so that you can see whether your program is actually making a success or not, and to treat with antibiotics, ORS, and zinc. So this is to show how you can use the Sphere handbook to integrate different chapters in the project work. Obviously, in the scenario I was giving, also nutrition was checked whether it's an issue or not, and we had anthropometric surveys looking for acute and chronic malnutrition. And we found, and this is for the WASH people, is the standard to measure the mid-upper arm circumference to establish whether a child is malnourished or not acutely. And we found that 1.2% of the children aged 6 to 59 months were acutely malnourished, and 42% of the children were chronically malnourished. Again, the Sphere handbook is giving interpretation. Now, 1.2%, does it warrant a big program? We call them CMAM programs, community-based management of acute malnutrition. It does not, whereas 42% of chronic malnutrition is a very high value, and that's what I'm trying to point out here also, acute and wasting on the interpretation of the findings on the population level. Under 5% in acute wasting it's not acceptable, because every child individually has the right for treatment, but that should be dealt with by the health system. If acute wasting comes above 10%, it becomes serious, according to WHO definition, and then prevention and treatment measures need to be considered. For chronic malnutrition, height for age is measured, and we had 42% in this case, so we were having a problem with chronic malnutrition. And I'm going to suggest one approach to deal with that. That's called positive deviance. Some of you might have heard that approach. In French, approche maman lumière. And it is really the idea to go into communities, check, look at the families, see which children are better nourished than others. Take the mothers of the better nourished children to train them as trainers, so that they can teach their peers on what to do to nourish the children better. And this approach can be used in many different ways. So you have the TOT approach. You have sessions together with the mothers where they train each other. You can introduce the wash messages. You can introduce hygiene messages. You can use it for immunization. You can use it for many different public health messages. And in that way, in that approach, and that's why I'm advocating for it here specifically in WASH and nutrition, you can combine the messages for WASH and nutrition, and you have the same people delivering messages, train mothers so that they can train their peers, and that's maybe an approach which can be used for WASH and nutrition. Thank you very much.
Thank you very much. Taking us to that practical level of giving us a very specific, at a global level, we always try to look for best practice. You're basically saying go to the community, find a best practice example right there, and build upon that with training of trainers. We have some time for questions from the floor concerning the presentation, for comments. Please, we have some microphones going around.
Thanks for that. It was a very interesting presentation. I wondered if the Sphere Handbook has anything specifically in the WASH section about testing water for safety of using breast milk substitutes.
Yeah, should I take it immediately? The Sphere Handbook is evidence-based, so it's taking the standards given by WHO and by other organizations, and it says specifically that there should be zero E. coli in drinkable water. So it's very specifically mentioned there.
Okay. We'll take maybe 2 questions at the same time, and then back to you.
Is it working? Yeah. Andrea Sonntag from Welthungerhilfe. I would be interested in hearing a bit more or some concrete examples on how you apply human rights principles when you apply the Sphere standards. Thank you.
And I'll add to it, because I found one. Essentially, if you look at mothers with well-nourished children to teach others, you're disaggregating people. Do you analyze those findings at a broader level, and do you hand them over when the humanitarian assistance phase ends and maybe potentially longer-term work by Johannita or by others comes in?
Actually, the example of positive deviance is not in the Sphere Handbook. It's like for more development aid work. So there are about 10 sessions, and afterwards handing over is basically to the community, and they are taking the knowledge on board or not. It depends on the community, but it's their program at the end of the day. I was mentioning the Humanitarian Charter as the principles in humanitarian aid, and I have 7 minutes here, so it's very, very short, obviously. Usually I'm training the whole chapter on humanitarian charter and protection principles and core standards in 1 full day, and there we will have examples. So here I was just mentioning the basic idea of Sphere, that reaching the standards given in the technical chapters will enable the people to live with dignity. But in longer trainings, obviously, I will have examples.
I'm Ulrike Pokorowski from GIZ. I would be interested in your view about transferring the sphere approach when it's about especially chronic issues from humanitarian assistance to development cooperation. Do you think it's useful? Which part of it may be useful? Which parts may not be not so useful?
Interestingly, I've given the talk also longer in WASH-specific sessions, so I was focusing on sphere and WASH, and mainly people from the development aid were commenting that it is very useful to have these standards and to use them and to have an agreed set of standards so that in cluster meetings, for example, we don't have to discuss about the standards all the time, but we use them. For development aid, people were thinking about whether or not something like that can be developed as well. In the WASH sector, I think there were people in the German network who were from Border, for example, in Bremen, who were thinking about developing it. I think it can be used in development aid. For example, if you have a refugee camp and you are fulfilling the sphere standards, and outside of the refugee camp you have the host population and the sphere standards are not met, at least you can use the sphere standards to cover also the needs of the outside population, which would then not be the task of the humanitarian aid organization, but development aid organization. That could be an example, for example, where they can be helpful.
Okay, my name is Mohamed Baro. I'm a nutrition specialist, and my question was, why don't you use weight for height index instead of MUAC to monitor the acute malnutrition? You would probably have a different rate of malnutrition.
Actually, in my slide, it is also mentioned, and WHO is also mentioning it, and we are aware of differences in the outcome. So normally we are using both, and then we will draw our conclusions. But for shortness of time, I have just mentioned the MUAC example now. But you have seen also the picture of the scale, for example, which is then for the weight over height.
Yeah, I would like, my name is Alam. I'm working as a policy advisor with the Sun Movement Secretariat. I would like to complement the previous question in regard to transformation of the humanitarian sphere standards in the development context. The one thing which was limitation we found during implementation was that it refers to the minimum standards in humanitarian setting. While the development context, the targets are different, and mostly the development partners would aim for the maximum, not for the minimum. And then it's very hard to tailor these targets in the development context. The indicators are quite good in terms of the reach and the coverage, but it shows in humanitarian context, since the situation is different, so you have a limitation, and that's why the clusters refers to the minimum standards in camp, in hosting population, while in development context, the aim is to reach to a maximum with the quality as well. So that's just to complement.
Thank you.
Thank you, Oliver. Big round of applause, please.